lecture. So remember during the lecture, this is part 2 of the vagus nerve series. That if you have questions, send them up to the chat. So there's a little chat button there, and we'll store those questions, and then I'll leave it a few minutes at the end. Purpose of the lecture is to be kind of short and sweet, 20 minutes to work through part 2, which is measuring the vagus nerve and why this is so important. Okay, so great to have you on. Also, we'll have a recording at the end that we can forward if you need us to yourself or to somebody else. So last time we met, almost a little bit over 2 weeks ago, we talked about the power of the vagus nerve, how important the vagus nerve is. It is so significant to regulating our body. If you remember, we talked about how the vagus nerve starts up at the brain. It's called the great nerve, the wanderer. This vagus nerve goes from the brain all the way down into our small intestine, and it interacts with every organ. And its job with these 200,000 nerve fibers is to keep everything regulated or in check. It's like the speed limit for everything. And without the vagus nerve, our heart would beat about 105 to 110 beats a minute. I actually just got back from a weekend at a clinic that I work at every month down in Naples, a 3-day week, Friday, Saturday, and Sunday. And we saw about 20 patients, and we're looking at their vagus nerve before they get something called exosomes, and then after they get exosomes. And a majority of these patients have ALS, Parkinson's, dementia, or other significant neurodegenerative diseases. And what you'll see is in these diseases is that vagal tone goes away, and one of the first indicators is that the heart rate gets very fast. And so we'll see heart rates as high as 105, 110, and then when we measure the vagus nerve, we'll see that it's not working like we want it to. So currently, if you look to the right here, you should see this thing kind of clicking along on the screen, and that is actually me. You're looking at my heart. You're looking at something called the R to R interval. So those are the beats between the distance between every beat of my heart. Okay, so you see those little spikes, and then there's a distance, a space between that, and that's measured in milliseconds. And when you're measuring, one of the variables of measuring how the vagus nerve is working is to measure the distance between these beats. Now, just kind of intuitively, we think, well, the distance between those beats should be the same, kind of like a metronome. Like it should be beat, if it's 1 second, 1 second, 1 second, 1 second. But that's actually not the case. It's the opposite of that. The more distance or variability between those beats is actually going to indicate how strong my vagus nerve is and how strong my heart is. You've heard of things like heart rate variability, and a big measure of that is something called RMSSD or SDN. And those are statistical formulas done on the distance between these beats. Okay. And there's devices like Aura Rings, Whoops, Apple Watches that measure that distance. They do it with something else called a PPG. I'm actually using an ECG, which is the most scientific way to measure it, where I have a polar strap with a positive and a negative sensor across my chest, and I'm getting an actual ECG. That's the most reliable way to get that. Um, but the reason that we want to see that signal is that starts to give us some indication of the strength of the nervous system. So if I was to go back to this screen, okay, and this might be hard to see on your end, but these are little dots that are sometimes going up and sometimes going down. And if you look at the scale on the left, those are the milliseconds that's occurring between each of those beats. So there's the beats, and then these the dots representing the distance between the beat or the variability. And you have to know that to understand how the vagus nerve works. And we're going to talk about why that's so important. So let's move out of that. And I'm going to share another screen with you. And I want to walk through a little bit of the math of this, which is quite fascinating. Let's go to here. Boom. Okay, so you should be able to see this spreadsheet. Okay, this is actually a 90-second reading. So over here in this cell, over here and where the yellow is, that is each second my heart is beating. And that's the distance or the R to R between each of these seconds. 1008 milliseconds, 1016, and going through the list as it goes down. Okay. So here is an example of before I got on, I did 90 seconds of measuring my heart and those beats. And here they are. These are all the beats and the distance between the beats. Okay. Now, what I want to show you is if I then map it out, that's what I looked like in that 90 seconds. Those are the up and down beats of my heart. Okay. What we want is those to be symmetrical. And the whole reason we do the breathing program with you is try to change some of the chaos in the heart and make it more symmetrical. So this is actually my heart over 90 seconds with all those beats. And if I looked at right about here, the average would be my pulse or my heart rate. Well, that isn't a really good measurement of all the different things going on. It's just an average of all those. Now, I want you to watch what happens when I breathe correctly. So this is just my heart just kind of doing its thing. The beats are all over the place. The millisecond distance is all over the place, giving me a representative of my vagus nerve. And what I can see is it's not working very well. But watch what happens when I breathe. So I'm going to do 90 seconds later, and I do the diaphragmatic breathing that we're teaching you, and we're working on that. 90 seconds, same guy, same situation. And then I want you to look at the symmetry of my beats. Same guy, same heart, just 90 seconds later. But do you see how the beats have now gotten into a rhythm? This rhythm is activating my brake pedal of my vagus nerve so that I can now perform at a totally different level. So we want that rhythm of upbeats and downbeats to be in control. And you'd think, man, I can't control my heartbeats. Yes, you can if we control the oxygen flow. Now let's just kind of emphasize how important the heart is. Okay, every day we beat 115,000 of these beats. 115,000. That's a lot of beats. In a year, you're going to beat your heart, these beats, every one of these beats, 42 million beats. 42 million beats. That's insane, right? And in your lifetime, if you live to 85 or 90, you're going to have your heart beat over 3.7 billion beats. What we want is for your heart to be optimal and to beat in this pattern so it activates the vagus nerve versus this pattern here. And that's what we're working on. So let's get in a little bit deeper about how we measure the vagus nerve. Now, remember, we got about 10 minutes left. If you have questions, send them up to the chat, okay? So that's how we're measuring it with the R to R interval. But I want to pull out a couple things for you guys, okay? So let's go ahead and pull this up. Okay, so there's two different ways that you can measure heart rate variability. There's something called PPG, which is measuring your pulse waves, and that happens off of anything that's just kind of on one side of the body. So like a whoop measures PPG, an aura ring, PPG, even our sensor that comes in our kit, the TPS, measures PPG. The heart math clip that goes on the ear, that's PPG, that's blood pulse volume. You can get some decent readings from that, but you really can't get a good measurement of the vagus nerve unless you're actually doing something with an ECG or an EKG. And that's measuring that R to R interval. Okay. That's super important if I'm trying to read the vagus nerve. So something like a Whoop and an Aura ring are telling you like these heart rate variability numbers, but there's so much artifact and it's not actually measuring the electrical current that they don't put the factors in that we need to give you an accurate reading of something that would be valuable for your vagus nerve. What we recommend that you use is the Cubios app with a Polar H10 strap if you want to learn about how your vagus nerve is working. So let me give you an example of a vagus nerve and how it's working. So this is an individual that I saw in the clinic this last weekend. This is somebody with ALS, okay? So they have a neurodegenerative disease, and we're measuring all the factors of the vagus nerve. And if you look at the top, you can see those interbeat intervals and you can see how scattered they are, right? And we want to get more symmetry. I'm going to show you a pro quarterback in a second and how it looks different. But do you see the top, the beats are kind of all over the place, okay? So what we want to look at is how does that show me what their vagus nerve is doing, okay? So there's two major things we want to look at. By measuring those beats, I can see what their parasympathetic or their brake pedal is doing. And in the vagus nerve, we want the parasympathetic to always be greater than zero. We need your body's brake pedal to be greater than zero. And this person is a negative 1.84 standard deviation. So that means they're about 15% of what their brake pedal should be doing is actually happening. So the vagus nerve is meant to slow everything down. And I can see that this person with ALS is their vagus nerve is not working correctly because it's a negative. You can see this number every day with a polar strap and a readiness measure off of Cubios. That's something that we can help you with. Now, the other thing that's super important with this person is the brake pedal's not working. Okay, it's negative. And then the stress, which is called the SNS index, okay, that's the sympathetic nervous system index. Super important that we're seeing this. We need the stress index to always be less than zero, less than zero. This person's is positive 3 standard deviations. So I know two things now. I know based off of their R to R interval, their vagus nerve is not working correctly. They're not brake pedaling correctly. And there's the stress is overtaking their body. Okay. Very important to know. And then the last thing is their overall ability or capacity for managing stress, RMSSD, we need that to be over 30 and this person's 10. So I can tell that that's very difficult for them, that their vagus nerve is not working. So now let me pull up, I'm going to show you the vagus nerve of a NFL quarterback 1 hour before Monday Night Football. That's kind of cool, right? So let's go ahead and pull that up, okay? And see if you notice any differences, okay? Let's see. Okay, so let me make this a little bit bigger, okay? And let me get all these things off of here. And so now that I've looked at these R-to-R intervals, what's the first thing I think that should jump out at you, okay, is do you see the beats of the heart right here? Look at the beats of the heart. I mean, that is just amazing, right? You remember the other one was all chaotic? This was taught to this person. This is what we teach you at Royer Neuroscience is how to get this thing working. So this is an hour before Monday Night Football. This person should be super stressed. Their recovery mechanism should be compromised, but look at what their PNS, which is their brake pedal, I want it to be greater than 0, is a 2.62 standard deviations, meaning it's at the 99th percentile in its overall functionality. And a lot of that is because we've trained the vagus nerve to do that. The other thing that we see right away is that their stress index, which the environment is very stressful, is now a -1, meaning they're not letting the environment impact them. It's kind of like Teflon. They're pushing the stress off of them. And that's a trained thing that we can teach the body. Now, the one last thing before we kind of get to the last few minutes here is their RMSSD. Remember in the ALS patient, it was 10. This quarterback is 132 in his heart rate variability, meaning his ability to expand and flex under pressure, which we've taught him how to do that by managing his vagus nerve, is at an extremely, extremely high level. Okay, let's look at a couple other things and then we'll kind of finish up here and I'll take any questions. Okay, so we looked at different things. The 5 main things that I want you to think about when we look at, well, why do I even want to measure this thing? First of all, it gives us a daily readiness. It gives me an understanding with a 3-minute measurement in the morning how my central nervous system is working. It can tell me if I'm ready for the day. It can tell me if I'm fatigued. It's tell me if I'm stressed. And in the athletic environment, it tells us if somebody's prone to an injury. But it gives you a kind of like that speedometer of, okay, how fast am I going? So I know how to enter my day. Maybe I need to rest a little bit more today, or maybe I've got a ton of energy and I'm ready to go. I actually had used this for a different quarterback before one of their games, and I was able to see that they were actually going a little bit too slow. And I said, hey, you need to get amped up a little bit more. And he got back to me that night after the game and said, it completely changed how I played because I understood where my body was, not just what my head was telling me. It's an early detection of dysregulation. We saw an extreme nature of this in the ALS patient, but we can pick up signs of disease early on, like Parkinson's and especially inflammation in the body. We can see that right away. And we can pick these things up early so we can be more proactive. And then number 3, which is the really important thing, it's your superpower. You're going to learn about this next time we meet. This is how can I sync up my breathing with my heart to be the best version of myself? And that is when we can get both the frequency of the heart at 0.1 and the frequency of the breathing at 0.1. And that creates that perfect sine wave. It's going to help me track my recovery over time, how well I'm adapting, and then it helps me make decisions about different things that I'm doing through the day as far as exercise and different forms of treatment. Last couple things, and then we'll take questions. This is what we're going to learn about next time, is how my breathing rate should line up with my heart rate, and that's called a resonant frequency. And every one of us is capable of this, but when we're in resonance, we focus better, we perform better, we're more accurate, we're more creative, we're more resilient. And we're going to talk about how do I get into resonance with my breathing and my heart to unlock this superpower. It's the perfect balance between the two. And as I said earlier, I strongly recommend for you guys that are listening to think about getting one of these polar straps and for us to help work through with you how to measure your vagus nerve off of this app called Cubios that we work hand in hand with. So we can see what the parasympathetic response, the slowing of the nervous system, and the stress is, and all these other variables. Okay, my time is up. We try to make it short and sweet. So do I have any questions in the chat? Any questions in the chat? Anybody have anything? We cruised through some stuff pretty fast. Any questions you want to ask through the chat, feel free. Uh, in the meantime, the whole reason we're trying to get the diaphragm when you're breathing to be in an exact lowering or dropping of the diaphragm and coming back up through the belly breathing is we're trying to get the rhythm of that breathing to line up perfectly to make that heart beat in that perfect rhythm that you saw earlier. That's really the beginning of the superpower of unlocking the power of the vagus nerve. So you might say, man, why am I doing this breathing? Well, you're doing it because we know it's the precursor to getting the cardiovascular activity, the beat to beat interval, in a synchronized manner that then lets the vagus nerve do its job. Yes, we can get one of those from us, or you can order them on Amazon. It's called a Polar H10, a Polar H10. Um, and if it's something that you want to work with, uh, Taylor, who's kind of managing today, she's the one who manages all the polar straps. So you can either get it through Amazon and you can have a version, have it for yourself. They're about $100. Or we can send you one and you would send that back to you. If you're in the program and you already have a kit, we just would need it back. I personally think that this is a device that should be part of your long-term toolkit. You should be looking at this constantly. And then you're going to really like this is my other business partner in Inner Armor. He has been working on interfacing the Polar H10 strap into the Inner Armor app, and we just released that recently. So you can now use the Polar strap to do all your power exercises. You can use it for power refining, where you're trying to develop coherence and you used to use the TPS for it. You can still use the TPS, but the Polar strap, especially if you have any circulation issues or you find that you lose signal off of your uh, TPS, sometimes that's a circulation issue. With the chest strap on, you will have pretty much perfect signal all the time and a lot easier for you to have less artifact. The only thing is you have to put the strap on up against your skin. We don't currently use the straps at our kiosk, like at Liberty University and ECU and these other places, because it's kind of an open setting and we probably don't want people pulling up their shirts all the time. But you guys at home putting these straps on and working with them, I can see a couple of people on here that I know have been using them. And it's been fascinating to kind of watch your scores over time. Can it transmit to a Garmin? The Polar, it can go to the Garmin, but you're not going to get um, the statistical analysis. You saw all those heart metrics that I did on there. You're not going to do the, you wouldn't want to necessarily transmit it to the Garmin. You would just want to transmit it, the Polar strap, to the Cubios app on your phone. So I had what you saw up there on the screen was my Cubios app. I have my H10 Polar strap on. I open the strap, I put in my code, you join my team, which is the Royer Neuroscience team, and then you can send every time you do a session that data comes up, and then every 10 sessions, Taylor will send you a graph of all your findings. So you would be transmitting it, the Polar, to a Garmin more for if you're watching your heart rate while you're exercising. This is more to do very detailed statistical analysis on not just your heart rate, but everything related to your vagus nerve. And this device works perfect for that. Uh, could you use it while cycling? You could do the readiness feature. So we do this at our clinics, like we did in Naples, where the person comes in and we turn on the device, and all throughout the entire hour they're there, we're recording what the heart signals are doing. Um, Before measuring on us while you're cycling or exercising, I would first want to see what are you doing when you're sitting and breathing correctly so we know what your baseline is. And then you could wear it for an hour, 2 hours and see um, what parasympathetic, sympathetic, and RMSSD are doing while you're exercising. The other thing you can do, which we talked about last time, was you can actually wear it all night long, and we can look at all the different patterns of what's going on with your vagus nerve while you're sleeping, which is a really cool asset. Okay. Um, I have 2 minutes left. Anybody else want to throw in a question or two? Hopefully you now know, well, how do I measure this thing? We measure it through R to R interval. Needs to be an electrical signal. Best way to measure the vagus nerve is through that R to R signal and then do some advanced metrics on it so we can see the parasympathetic side, the sympathetic side, a non-artifact version of RMSSD. You will not get that, I promise you, off your Apple Watch. You will not get those metrics the way that they need to be off of these PPGs. The PPGs are good for a certain purpose, but not for us to fully understand the power of the vagus nerve. How do we get to the point where it's all about, and you'll learn about this next week, is it's all about the peak frequency of the heart aligning with your breath. So do you remember the two signals I showed you earlier where my heart was very scattered? And then I started doing my diaphragmatic breathing, and then I got my heart to start to beat in that rhythm or coherence. Right now, you guys know some about coherence because you're trying to build the coherence, the green bar, you're trying to get that bigger. But in vagus nerve training, we're looking at a very precise frequency of the heart and how that aligns with an exact frequency of breathing. And you can get that through looking at the vagus nerve. I'll just show you one last thing. So if you look at, let me pull this up. This is pretty cool. Okay. So if I show you, um, right here, and this is a great question. If you can see this, down here, there's this little green dash line, and then this is the orange thing is the peak frequency of this person's heart. The green dash line is their respiration rate, which is coming in at 0.9, 0.09, and their heart's coming in at 0.8087. If we can get those to align at 0.1, we get the ultimate frequency of the heart and resonance in the heart. So look at this in relation to this last one. So that they're lined up, but then look here. Do you see this is the respiration rate over here? And then their peak frequencies are all over the place. And what we have to do is teach the breathing rate to land right on this peak frequency. And you're going to learn about that next week because that is the ultimate of peak performance on the heart, the autonomic nervous system, the vagus nerve, and the entire body. Okay? Hey, it was great seeing you guys. We're going to meet again in 2 weeks. Thanks for coming out to the lecture. And next week, or in 2 weeks, we're going to talk about the superpower that we can unlock in the vagus nerve. Okay?